So, when you picture a clinical psychologist, what comes to mind? Is it kind of a mysterious figure, notepad in hand, silently analyzing every single thing you say? Well, today, we're going to pull back that curtain. We're going to unpack the practitioner's blueprint to see what this profession is actually all about.
All right, first things first, we have to completely dismantle the pop culture stereotype. You know the one, the old Freudian myth of a patient lying on a couch, spilling their secrets to some passive therapist who's just taking notes? But the modern clinical reality? It's a whole different world. It's face-to-face. It's a collaborative conversation. There's no desk, no barrier. It's just two people working together to figure things out.
So, if that old image we all have in our heads is a total myth, then what's the reality? What does a modern clinical psychologist actually do all day? That's the central question we're going to answer right now.
To really get it, we have to start with the absolute core of the profession, the one guiding principle behind everything they do, and that's called the scientist-practitioner model.
So what's the official definition? Well, it's a professional who applies scientific principles to understand and help with a whole range of human problems, emotional, behavioral, you name it. And that little phrase, scientific principles, honestly, that's the key to this whole thing. This Venn diagram shows us exactly what that means. See, the profession isn't just one thing. It's really the integration of two big roles. On one side, you've got the scientist, all about research, data, and theory. On the other, the practitioner, focused on direct patient care. The clinical psychologist lives right there in the overlap, blending science and practice into care that's actually backed by evidence. So, here's the crucial insight, the thing that really sets them apart. Clinical psychologists aren't just trained to use existing knowledge, they're trained to actively create it. They are both the scientists figuring out what works and the practitioners applying it to help people. This dual role is what makes the field so powerful. Okay, so now that we have the foundation, let's explore the scope of their work. And you might want to brace yourself because it is way broader than most people think. We're talking about 8 distinct domains of practice. I think this grid is fascinating because it organizes those 8 areas so well. Look at the axes here. You've got direct patient care versus building knowledge, an individual focus versus a huge systemic focus. It shows you right away that their work can range from a one-on-one session with a single person to shaping entire healthcare programs. Let's start with the roles most of us are familiar with. You've got assessment and diagnosis. That's all about figuring out what's really going on. Then there's intervention and therapy, which is the process of helping. And, super important, there's clinical supervision, where experienced psychologists train the next generation of therapists. But now look at all this. This is the side of the job a lot of people never see. They're doing research to push the whole field forward, they're teaching at universities, they're consulting for schools or even big companies, they're developing massive programs like mental health support after a disaster, and they often end up in charge, running whole departments or clinics. Okay, so we've seen the theory and the huge scope of the job, but let's get practical. Let's look at the clinical process in action. What actually happens when a person walks into their office asking for help? Well, it all kicks off with assessment. And this is not just a casual chat, it is a systematic process. We're talking psychological tests, really detailed interviews, and careful observation. All of this data gets funneled toward answering one central thing, the referral question, which is really just a simple way of asking, why is this person here, and what's the real root of the problem? And here's a perfect real-world example. Say a 4th grader is failing their classes. The teacher's referral question is just, why? A really thorough assessment can pinpoint if the root cause is a learning disability, maybe emotional distress from something happening at home, or maybe an attention deficit. You see, without that proper assessment, any help you try to offer is just a shot in the dark. After assessment, we get to diagnosis. And this is a very careful, very deliberate process. Think of it like a problem has to pass through a diagnostic filter. First, is it causing significant distress or getting in the way of their life? Second, is it coming from an internal source, not just a normal reaction to a terrible event? And third, is it something they can't consciously control? Only if a problem passes through all 3 of those filters is it actually classified as a psychological disorder. Once the diagnosis is clear, we move to the engine of intervention. And this is a structured 4-step process. First, they conceptualize the problem. Then they formulate a treatment plan with the client. Next, they implement that plan. And finally, and this is so crucial, they evaluate if it's actually working. The whole point is to empower the individual, to give them back control over their own life. So you have to be asking, how does someone learn to do all of this? The training is, well, it's incredibly rigorous. Let's take a look at the pipeline, the long path you have to take to become a licensed clinical psychologist. I absolutely love this metaphor of a training bridge. Think about it. On one side, you have the foundational coursework, all the theory. On the far side, you have independent practice. So what gets you across? Well, the bridge itself is built out of hands-on work, practicums, and a full-time internship. And holding the whole thing together are these essential cables, constant clinical supervision and research. Breaking that journey down, you can see the stages pretty clearly. It all starts with years of foundational coursework, things like psychopathology. Then comes the practicum, which is really the backbone of training, where you start applying that knowledge under supervision. After that comes an intensive full-time internship, which is really the final bridge before you're licensed for independent practice. Now, within that whole pipeline, there are 2 main doctoral paths you can take. There's the PhD, which follows that scientist-practitioner model we talked about, really balancing research and clinical practice. Then there's the PsyD, which is more of a practitioner-scholar model with a heavy focus on clinical and therapeutic skills. So a PhD often leads to a career in academia or research, while a PsyD is usually geared toward pure clinical practice.
Okay, we have looked at the foundation, the scope, the process, and the training. So now it's time to zoom all the way out and put all of these pieces together into the big picture.
And this diagram, this really ties it all together in what's called the continuous loop of clinical excellence. Just look at the two sides. On one, you have knowledge generation, which is research and assessment. On the other, you have knowledge application, that's the therapy and program development.
But the most important part is that feed in the middle, going both ways. This is not a one-way street. The challenges and questions that come up in actual clinical practice directly inform new research. And then, in turn, that new research constantly flows back to elevate the quality of patient care. It is literally a self-improving system.
So, here it is. Here's our main takeaway. The modern clinical psychologist is not some isolated therapist from an old myth. They are a vital part, a critical node in this dynamic, continuous loop of science and practice. And because of that, their work doesn't just help one person at a time, it helps elevate the entire mental health ecosystem. So we'll end with the final question for you to really think about. Now that you've seen the science, the training, and the systemic thinking that goes into the practice of clinical psychology, how does this change your view of what mental health care is and what it has the potential